I'm Dr. Sylvia Ramirez, a Harvard-trained and U.S. board-certified physician, and I'm the Medical and Scientific Director of Cutis Medical Laser Clinics. Today, I'm going to speak about pigmentation, which are typically dark brown spots or patches on the surface of the skin. Pigmentation or hyperpigmentation is a very common condition. Most of the time, it happens because of UV or sun exposure, leading to what we call freckles or sunspots or lentigos. Sometimes this can result from irritation of the skin, resulting in what we call post-inflammatory hyperpigmentation. But also, particularly in women above the age of 35 or 40, we may develop brown patches known as melasma. Melasma is a type of patchy pigmentation that typically also touches the junction between the top two layers of the skin. And this is what we call dermo-epidermal melasma. This is therefore deeper and generally more resistant to treatment. Epidermal pigmentation is pigmentation located in the top layer of the skin. It is therefore shallower and generally easier to lighten. Epidermal pigmentation, such as freckles, or post-inflammatory hyperpigmentation, which is pigment that develops after some irritation of the skin, can be lightened with topical lightening medications such as hydroquinone that are available only through clinics and should be used with the oversight of a physician. On the other hand, deeper forms of pigmentation such as melasma, which generally results from hormonal changes, may be more challenging to improve and may require longer application of topical lightening medications. At Cutis, we start by doing a computerized skin analysis to properly identify the level of pigmentation. We then discuss clinical options with our patients, allowing each one to make informed decisions about treatment options and potential treatment outcomes. In general, there are several options to reduce or remove pigmentation, and often a combination of treatments provides significant results. First, we provide prescription lightening treatments such as our advanced Clear Skin program, consisting of clinically formulated products with prescription-strength hydroquinone that can change the skin at the cellular level, lightening pigmentation and blocking melanin production that causes pigmentation. Another treatment option for epidermal pigmentation includes chemical peels, an example of which is our Cutis Crystal Peel. This is an effective skin lightening treatment to address dull skin and is also used to lighten freckles and age spots on the face and the body to result in a youthful glow. We also use the Vitality or VI peel, a specially formulated chemical peel that uses combinations of acids and antioxidants to improve the skin tone and texture and maximize the clarity of the skin. Often, we include lasers and light treatments to effectively reduce pigmentation in the epidermis and dermal layers. An example of a light treatment is our Limelight Photofacial from the Cutera line of lasers from the United States. This is an FDA-approved, time-tested, intense pulse light or IPL technology to remove sun damage, brown spots, and freckles in any part of the face, neck, décolleté, and even the hands and arms. Another type of laser treatment that we do for pigmentation is laser skin resurfacing, known as the Pearl treatment. The Pearl is an FDA-approved skin resurfacing procedure which removes the top layer of the skin with pigments and other textural concerns while stimulating collagen in the deeper layers of the skin, thus resulting in a pearly glow. Removing or lightening pigmentation is only the beginning. It's very important for us to prevent further development of pigmentation. So one of the key aspects of overall anti-aging and prevention of pigmentation is protection of the skin. Every day, we need to wear a sunblock, even as we just go from our home to the car to the office. UV rays can penetrate through the windows of the car or of our homes. UV rays are responsible for 80% of aging of our skin, and so it's very important to continuously and regularly apply sunblock that is of broad spectrum, which means it protects against damaging UVB and UVA rays. Reapplication of sunscreen is also necessary as it washes off right after once we sweat. Using an SPF-infused spray is also a quick and easy way to reapply a sunscreen, especially if you don't want to ruin your makeup. If you want to learn more about the pigmentation that you see on your skin, such as what is the type, what is the depth, and most importantly, what is the treatment that is appropriate for you, please don't hesitate to contact us. We also encourage you to look at our other videos by subscribing to the Cutis YouTube video channel. Have a great day.